अस्सलाम वालेकुम, वेलकम बैक टू माय चैनल। आज की इस वीडियो में हम डिस्कस करेंगे MCQs ऑफ जॉइंट एंड सॉफ्ट टिश्यू इंजेक्शंस। A 34-year-old man presents to your office requesting soft tissue injection of painful trigger points in right shoulder. He read about this therapy on the internet. He works as a laborer at the local landscaping business and has tried a variety of treatments including acupuncture and chiropractic manipulation for chronic intermittent pain in his right shoulder. There is no history of trauma or arthritis. On examination, he is a muscular white man with several tender points along the anterior border of his right trapezius muscle. The rest of his examination is normal. MCQ 1. All except which of the following are reasonable and acceptable reasons for the use of diagnostic and therapeutic injections? Answer is B. To deliver an antibiotic into an infected joint space. MCQ 2. Which of the following is not an absolute contraindication to do a therapeutic corticosteroid injection? Type 2 diabetes. MCQ 3. Possible complications of a therapeutic corticosteroid injection include all except which of the following? Induction of coagulopathy. MCQ 4. Post-injection instruction should pay particular attention to which of the following? Proper dressing, sign of complication, mobility restrictions, use of medications. Answer is E. All of above. Problem 2. A 58-year-old woman presents to your office with acute onset of painful swollen hot knee. This is the first episode of this illness in this patient, which began 24 hours ago. There is no history of trauma, hyperuricemia, fever, chills, or other recent infection. Her only medication is hydrochlorothiazide for hypertension. On examination, vital signs are normal. Left knee as described with obvious effusion. The rest of the examination is normal. MCQ 5. Reasonable initial management at this time includes which of the following? Aspiration of affected joint. Laboratory analysis of joint fluid is obtained and reveals gram-negative cocci seen in pairs. What is the most appreciated therapy at this time? As intravenous ceftriaxone. Problem 3. A man with painful shoulder comes to your office with left shoulder pain of several months duration, not responsive to NSAIDs and physical therapy. The Hawkins test elicits pain with the shoulder passively flexed to 90 degree and internally rotated. MRI scan confirms your diagnosis of rotator cuff tendinosis that reveals no tear. At this point, you decide to inject a corticosteroid. 7. The most appreciated technique for delivery of corticosteroid includes which of the following? Preparation of pharmaceuticals and equipment, proper positioning of the patient, palpation of landmarks and use of sterile technique, appreciate needle approach and entry. E. All of above. उम्मीद है ये MCQs आप लोग के लिए हेल्पफुल रहेंगे। थैंक यू सो मच।